Essentially, this ring is going to pull, 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 and it's going to relieve more and more pressure as the pull gets stronger off of that low back. Hi, I'm Nicole, and I'm here with Taylor at Kalkstein Chiropractic, your Towson, Baltimore area chiropractor. We're going to be talking about some traction today. So here we have our lumbar traction set up, and we're going to go ahead and put Taylor in that today, kind of explain to you what it's going to do and what it's going to help for you today. So I'm going to have Taylor lay on her back here. She's going to have her head up at that end with her feet this way. Ooh. Perfect.
Is mine too high?
Just go ahead and have your head up on the pillow, and then I'll kind of adjust the straps if we need. So the traction bed here, we want to make sure when we're starting that the bed is locked. You want to have it locked before you start and unlock when the traction goes. Here we're going to make sure that the straps are in the right place for this lumbar traction. So the bottom strap here, we're actually going to bring up a little bit so it's not more on her hips, and it's kind of wrapping around that belt. You can come down. It's going to wrap around that belt area on her, so that way when it's tight and going, it's not going to pull down onto her legs. We want to have it up here above the pelvis. And then I'm going to give her a little tug. We want these straps kind of tight and secure to make sure she doesn't move. And let me know if you can't breathe. Okay, Taylor? All right. How's that feel, okay? Mm-hmm. Cool. All right. Now, I'm going to go ahead and add the second bolster under her leg. So these bolsters are just going to kind of bring some pressure off of that low back here, make her a little bit more comfortable while she's laying flat. And then I'm going to go ahead and grab the second belt strap before we go ahead and finish her off for the top strap. So this strap, we're going to tighten and hook to the traction machine at the end of the table. So tighten in here. Let me know if it gets too tight. Cool. A little more. All right. Skinny. And this center loop here is what is going to attach to the machine. So we want to make sure that is centered on her and out in the open. Then we're going to bring our final strap here. This strap we want to make sure is not covering that loop and is also underneath the chest area. That also is going to come very tight. Again, Taylor, let me know if it's too tight. All right. How's that feel, okay? Mm-hmm. All right. Pretty secure in there. We're going to go ahead and bring this bottom guy up, hook onto the loop here, and then we're going to find the other ring. This is what is going to attach to the traction machine. Going to raise the table up. So when she is laying in this position with her knees up on the bolsters, it's relieving that pressure off of the low back. The machine, when we turn it on, is then going to take it a step further. It's going to kind of pull forward, releasing that pressure from where the straps are down. So if you have a lot of that jumped up feeling in your low back, where you feel like you're real tight, can't move, can't rotate, usually this is what's going to help that. Let's go ahead, come to the machine here. We're going to bring the rope from the machine, hook that bad boy onto that clip that I've just brought forward. And then we're going to make sure this rope is nice and tight. That's what's going to bring in that pull. And now we're going to check our bed, make sure everything looks good. This guy, pull. All right. So that pulling sensation is what's going to happen with the traction. Essentially, this ring is going to pull, 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 and it's going to relieve more and more pressure as the pull gets stronger off of that low back. And that way, make sure, yeah. And then the last step, of course, unlock the bed. That is what is going to make the pull move. The bed is going to succumb to the machine, and it's going to have a little bit of give. So we get a nice pull in that low back. That's going to relieve any of that pressure, like I said, any tightness. Sometimes you get a little bit of redness, intensity back there when you have some pressure in that low back. So usually the traction is going to go in there, kind of lift off of that pressure, let you move, give you some rotation, give you some mobility. Other than that, should be good to go. How do you feel, Taylor?
Feel cool.
Feel like you can breathe? Mm-hmm. Cool. Awesome. Well, that is it for us here at Kalkstein Chiropractic with the traction here. We hope to see you soon.